हेलो स्टूडेंट्स, आज का जो क्वेश्चन था वो यूरोलिथियासिस पे था, दैट इज़ रीनल स्टोन। और जो पिक्चर दिया गया था वो आपको एक क्लासिकल स्टैगहॉर्न कैलकुलस का था. सो लेट्स स्टडी यूरोलिथियासिस. So urolithiasis or the stones, they may form anywhere in the urinary tract, but mostly they arise in the kidney. Men are affected more commonly than females. Peak age is between 20 to 30 years, and there are familial and hereditary predispositions जैसे cystinuria, familial hyperoxaluria. Then there are four main types of calculi: calcium stones, triple stones or struvite stones, यूरिक एसिड स्टोन्स एंड सिस्टीन स्टोन्स. तो हर स्टोन के बनने के लिए एक ऑर्गेनिक म्यूकोप्रोटीन की मैट्रिक्स चाहिए. उसके आसपास जो कैलकुलस है वो फॉर्म होता है. सो वी विल रिपीट: कैल्शियम स्टोन्स, ट्रिपल स्टोन्स या जिसको हम कहते हैं मैग्नीशियम अमोनियम फॉस्फेट स्टोन्स, uric acid stones and cystine stones. These are the four main type of calculi. So this is how the crystals they appear in the urine. So these are the calcium oxalate crystals. They are said to be envelope shape. अगर आप देखेंगे ध्यान से तो जैसे envelope का कवर रहता है उस आकार के ये हैं. So they are said to be envelope shaped. Then uric acid crystals, they are said to be like plates, okay, or diamond shaped. Then struvite crystals, they are said to be coffin lid shaped or what we call a prism shaped. Okay, so this is coffin lid or prism shaped. And cystine, they are hexagonal to pentagonal. So these are the common crystals of the stones which appear in urine. तो कोई भी cause हो stone formation का, the process is initiation and propagation. The most important determinant is hyperconcentration or increased urinary concentration of the constituent so that it exceeds its solubility. कैल्शियम ऑक्सलेट की अगर बात करें तो जब कैल्शियम से सुपर सैचुरेट हो जाती है या हाइपर सैचुरेट हो जाती है यूरिन, तब वो डिपॉजिट होने लगती है और तब स्टोन फॉर्मेशन स्टार्ट होता है. Then calcium oxalate crystals or calcium oxalate stones, they are the most common type. They are associated in 5% patients of hypercalcemia and hypercalciuria, जैसे hyperparathyroidism, diffuse bone disease, sarcoidosis या दूसरी hypercalcemic states. They are caused by various factors. For example, hyperabsorption of calcium from intestine, then impaired renal tubular reabsorption of calcium, that is called renal hypercalciuria, or idiopathic fasting hypercalciuria with normal parathyroid function. So 20% are associated with increased uric acid secretion, so hyperuricosuric calcium nephrolithiasis with or without hypercalciuria. तो मैकेनिज्म क्या रहता है? न्यूक्लिएशन, मतलब जहाँ से एक स्टोन फॉर्मेशन स्टार्ट होगा. सो इट इन्वॉल्व्स न्यूक्लिएशन ऑफ कैल्शियम ऑक्सलेट by uric acid crystals in the collecting ducts, and 5% are associated with hyperoxaluria, that is hereditary or acquired by intestinal overabsorption in patients with enteric diseases. Or there is hypocitraturia, which can be idiopathic or associated with acidosis and chronic diarrhea of unknown cause, may produce calcium stones, that is idiopathic stone disease. फिर हम आते हैं मैग्नीशियम अमोनियम फॉस्फेट स्टोन्स, जिसको हम कॉमनली ट्रिपल स्टोन्स या स्ट्रूवाइड स्टोन्स कहते हैं. सो दे आर फॉर्म्ड लार्जली आफ्टर इन्फेक्शन बाय यूरिया स्प्लिटिंग ऑर्गेनिजम्स लाइक प्रोटियस एंड सम स्टाफ. द alkaline urine causes precipitation of magnesium ammonium phosphate salts, and they form some of the largest stones, staghorn calculi, which occupy the large portions of renal pelvis, are frequently due to infection. तो जो आज आपको एग्जाम में पिक्चर क्वेश्चन दिया गया था, that was of staghorn calculus. So that is a triple stone या struvite stone. Uric acid stone, they are common in individuals with hyperuricemia, such as patients with gout or leukemias. इसके लिए acidic urine may predispose to uric acid stones because uric acid is insoluble in acidic urine. Uric acid स्टोन्स जो रहते हैं वो रेडियो ल्यूसेंट रहते हैं, जबकि जो कैल्शियम स्टोन्स हैं वो रेडियो ओपेक रहते हैं। तो जो रेडियोग्राफ या जो एक्सरे है उसमें हमको यूरिक एसिड स्टोन्स अप्रिशिएट नहीं हो पाएंगे। Then cystine stones, they are caused by genetic defects in renal reabsorption of amino acids, including cysteine, leading to cystinuria. These stones also form at low urinary pH. So if there is increased concentration of urinary constituents which causes stone formation, changes in urinary pH, decreased urine volume and presence of bacteria, all these factors, they lead to stone formation. Morphology. They are usually unilateral in about 80% of the patient. The favored sites are renal calyces and pelvis and in the urinary bladder. If formed in the pelvis, they tend to remain small and they have an average diameter of 2 to 3 millimeters. They may have smooth contours or they may be spiculated. Staghorn calculus, जो आज का आपको क्वेश्चन था, there is progressive accumulation of salts leading to development of branching structures which create the cast of pelvis and calyces. तो ऐसा हमको एक pelvic calyceal system को recapitulate करता हुआ एक stone दिखता है. This is known as a staghorn, बारहसिंघा के सींग के आकार का. That is why they are known as staghorn calculus. This is how it appears grossly. You can appreciate that it is taking the shape of the pelvic calyceal system like this. This is how it looks like on the radiograph. This is another picture of bilateral calculi. This is how it appears grossly, such a large stone, gross appearance and radiographic appearance. Clinical features, they may be asymptomatic or they may produce what we call renal colic or abdominal pain. They may produce significant renal damage and they may manifest as hematuria and they may even predispose to superimposed infection. Thank you so much.